Hi everyone, this is Dr. Radhika from Pathopulse_Radhika. So, as we have only a few more months left for the NEET, I thought we'll discuss a particular system and daily we'll put up a particular tumor from one system. So, this week I thought I'll put up one tumor each day from the female genital tract. And to start with, today we have one of the most common uterine tumor, right? So now let's move on to the discussion. So this is one of the most common tumor. This is the gross appearance of the common tumor in the uterus, right? So if you see, the uterus appears like this, okay, right? So the uterus, you would have learnt in your anatomy. So your uterus has got an endometrial cavity. So this is endometrial cavity, and this will be lined by your endometrial tissue, right? And here you have your myometrium, which is made up of muscle, the smooth muscles, and you have different layers of muscles in the uterus, right? Then when you come down, you have the cervix, then your vagina, right? So now look at this I have drawn to give an overview of how normally it appears, because when you have multiple fibroids it can be distorted. So for those of you all who are finding difficulty in delineating the outline, let me just help you out. So this is the uterus which has been distorted by the fibroid. So this is your endocervical cavity, and here are you able to see the endometrial cavity? So this is your endometrial cavity, right? So the uterus has been sectioned, it has been cut, and this is a cut section, the gross appearance of a uterine tumor. So what are you seeing here? So this is not the normal appearance of the uterus. What are you seeing here? You can see some circumscribed means you'll be able to draw a clear circle around it, very well defined masses which are appearing a gray white. And we have something called walled appearance, like this, they have got a walled appearance. So this is the gross appearance of this tumor which is being shown here. So what is this? So I want you all to be very clear. Whenever you have a uterine enlargement, it could be a well-defined mass or an ill-defined mass. Sometimes your uterus can be still enlarged, but your well-defined masses may not be there. Just your myometrial thickness alone can be increased. I'll show you that image in the next picture. So whenever you have an uterine enlargement, you see whether the tumor is a well circumscribed or it's a diffuse sort of a swelling. Here, whenever you come across a very well-defined tumor with a firm gray-white walled appearance, your first diagnosis should be leiomyoma. So leiomyoma, myo means muscle, okay? So it's a tumor which originates from the uterine myometrium. It's one of the most common benign tumor in the uterus, right? So leiomyoma is a tumor of myometrial origin. So when you go back to the cell of origin, what will be the cell of origin? So because it's myometrium, it's a tumor of smooth muscle, okay? So whenever you see in a biopsy, smooth muscle appears like a spindle shape. So they will be spindle shaped, right? So there you will see cells like this. So spindle shaped cells will be there, which are present in the tumor, right? So you have different types of leiomyoma. So if it is present in the myometrium, within the myometrium, we call it as an intramural leiomyoma. Now look at this one. So here you have your endometrial cavity. It's projecting into the endometrial cavity. This we call it as a submucosal leiomyoma. But when you see this one, this is called subserosal. It's beneath the serosal layer. This we call it as a subserosal leiomyoma. Okay. So you have different types. It has nothing much to do with the prognosis, but the symptoms may vary depending upon the location. So any uterus with a well circumscribed mass, remember it's a leiomyoma, which is a tumor of smooth muscle origin, one of the most common tumor in the uterus. What else you need to know? Anything else about the leiomyomas? Do you think leiomyomas occur only in the uterus? No, wherever you have smooth muscle, you can have leiomyomas, right? So, if you have watched the video on RCC, I was mentioning about a particular type of leiomyoma. Any guess? So, you have something called pilar leiomyoma. What do you mean by pilar leiomyoma? That means you have leiomyomas in the skin, a cutaneous leiomyomas, and this can be associated with a particular type of renal cell carcinoma, which is usually papillary RCC, right? So sometimes you can have a renal cell carcinoma with multiple pilar leiomyomas and uterine leiomyomas. So when you have a constellation of features, always think of syndromes. So when you have pilar leiomyomas, uterine leiomyomas, and an RCC, particularly a papillary type, always think about a syndrome called hereditary leiomyomatosis renal carcinoma syndrome. Okay, so leiomyomas has got a syndromic association. Next is you have seen about a blood vessel. Your blood vessel has got smooth muscle and you can have leiomyomas in your blood vessel, especially in the veins, right? So this is about the leiomyomas. So gross appearance, always think when you have a circumscribed mass, think about leiomyomas, and histologically they will show spindle shaped cells. And to add one more point, the mutation associated with leiomyomas, you have something called MET12. So the mediator 12, this is the mutation which you see in leiomyomas, right? So now look at this image. Here again the uterus is enlarged. So this uterus is like kept it in a different position like this. I don't know how many of you will appreciate. This is your endocervical cavity. This is your endometrial cavity. Here again your uterus is enlarged, but you don't see any well circumscribed mass as you saw previously. Here only your myometrial thickness is increased. But what happens is, because of that you have something called trabeculated appearance. So remember that trabeculated appearance is seen in case of adenomyosis of the uterus. So what is adenomyosis? When you have this endometrial tissue in the myometrium, we call it as adenomyosis. So why I put this picture? To differentiate between leiomyoma and adenomyosis. So leiomyoma can also cause uterine enlargement. Adenomyosis can also cause uterine enlargement. But what's the difference? So leiomyomas usually produce a circumscribed mass, whereas adenomyosis, it's a diffuse enlargement of myometrium. In leiomyoma you have a walled cut surface, whereas in adenomyosis you have something called trabeculated cut surface. So this is how a trabeculated cut surface appears. Okay, so when you see this, it will be like trabeculations, right? So you have to know these difference between leiomyoma and adenomyosis. And histologically, leiomyoma is from smooth muscle, so you'll have a lot of spindle shaped cells, benign spindle shaped cells, whereas in adenomyosis you will have endometrial tissue in the myometrium. And the mutation seen in leiomyoma is MED12, which is mediator 12 mutations. So this is about adenomyosis and leiomyomas. So daily I'll post a video on one tumor from female genital tract this week. So thank you for your patient listening. Stay tuned for other videos from the FGT. Thank you.